Hey guys, Curtis Alexander. Let's talk about the side effects we can see with the medication Ozempic. Now, Ozempic is primarily used to help with diabetes. It's gaining some recognition as a weight loss drug, and I don't want to quite get into that. Let's just focus on the side effects. But what is important to note is what it's doing in your body. It will help you understand the side effects. So, it's a GLP-1 receptor agonist. That's a fancier way of saying it's going to do a few things. Number one, it's going to stimulate more insulin secretion in your body. Okay. The second thing it's going to do is decrease glucagon secretion. So we're going to have the effect of getting more glucose into the cells and having less glucose outside the cells. The other thing it's going to do is cause a slight delay in gastric emptying, and that's when you're on something like Ozempic, people will say, man, I just feel fuller. That's why you're feeling fuller, is because that delayed gastric emptying. Now, as far as side effects go, I want to keep this fairly simple. I'm going to talk about some of the more common ones, and I'm also going to give you some warnings. These are less common side effects, but ones that could potentially be serious that you need to know about. So first of all, as far as the common ones, and this is going to be dose dependent. We've got a couple of dosage ranges from zero point 0.5 to 1 milligram of Ozempic. So main one you're going to see is nausea. This is really common, 15.8% at 0.5 dose. And then if you go up to the 1 milligram dose, it bumps up to 20%, 20.3. So again, very common side effect you need to know about. Vomiting can also be seen, 5% at the lower dose, 9.2 at the higher dose. Also, we're seeing diarrhea at 8.5 and 8.8% respectively. Abdominal pain, 7.3. Interestingly, drops down a little bit as the dose goes up. One thing we see is that people, as the dose increases, they've been on it a bit longer, so some of these side effects can go down as they get used to it. Constipation, again, 5% drops down to 3.1%. But mainly, you can see most of our big side effects are going to be gastrointestinal, stomach related in one way, shape, or form. Now, let's talk about some of these more serious side effects. Warnings, I prefer to call them, I guess, in this case. Big one is thyroid C-cell tumors. These are primarily seen in the rodent studies, although there have been similar medications that act in the same way as Ozempic that have been linked to this. So any sort of thyroid tumors in the past, you want to be very careful, talk to your doctor about that. We can see inflammation of the pancreas as pancreatitis. If you have diabetic retinopathy, we can see complications. If you have diabetic retinopathy and you add in Ozempic, we can see low blood glucose, low blood sugars when Ozempic is given along with something like a sulfonylurea, which are some diabetes medications that cause more insulin release. So that's a drug interaction that you're going to want your pharmacist to check for. Okay. Acute kidney injury. As with any medication, any supplement, we can see hypersensitivity reactions. That means generally a rash, the serious hypersensitivity reactions, swelling of the throat, difficulty breathing. And then if you have any sort of gallbladder issues, you want to be aware that this has caused acute gallbladder problems in people. But I think the biggest takeaway from the side effect is knowing that probably going to be stomach related. Okay, so just keep that in mind. Let me know if you have any other questions in the comments. I hope this video was helpful, you guys. As always, make sure to go to my website, get your free checklist of natural therapies to help you get around some of these prescription drugs. If that is one of your goals, I share a number of therapies that I know to work well that I use personally. So make sure to go grab that. Hope it was helpful, you guys. See you in the next one. Thank you.